But our big story at 5 focuses on the challenges people face in getting mental health treatment.
Yeah, a staggering number of people who need help just don't get it. In fact, according to data from Mental Health America, between 2019 and 2020, more than 20% of adults experienced some sort of mental illness. Almost a third of all adults reported they were not able to receive the treatment they needed. News 6 investigator Lewis Bolden takes a closer look at why.
According to Mental Health in America, Florida ranks almost the last in the country in terms of access to mental health. And those who work in the field are well aware of the ongoing problems. According to the National Alliance on Mental Illness, nearly 2.9 million adults in Florida have some sort of mental health condition, and only about 36% receive any form of treatment, according to the Florida Department of Children and Families Substance Abuse and Mental Health Program.
The system is kind of broken in a lot of different places.
Dr. Megan Sherritt is a psychology professor at the University of Central Florida and says often people don't get the help they need because they can't afford it. She says about 13% of Floridians are at or below the poverty level, about 3 million people.
I would say a good portion of those folks are going to have clinical levels of anxiety, especially if you're living paycheck to paycheck. Clinical levels of depression, not knowing if you're going to lose your house.
Experts estimate 500,000 Floridians with a mental illness are uninsured. The Department of Children and Families Substance Abuse and Mental Health Program has services for low-income and uninsured people. But the State Commission on Mental Health and Substance Abuse found there are more than 1,300 people on the wait list every month. Those waiting sometimes end up in crisis.
I see it a lot. I work in a crisis center at the moment.
Marissa Gould is a first-year graduate student in the Clinical Psychology Master's Program at UCF. She gets hands-on experience at Aspire Health Partners in Pine Hills.
They haven't been able to afford preliminary care, reaching out to therapy, things like that, to receive care prior to crisis.
Mental Health in America ranked Florida 46th in the country in terms of access to care. Some are unable to access care due to financial reasons, travel time and distance to available services, and/or no available space at facilities. Too few facilities and a lack of mental health workers add to the problem.
I came from a really small town where there's a lack of resources.
Seeing the need is what drew Tylea Hernandez into UCF's Clinical Psychology Master's Program. She interns at Halifax Hospital in Volusia County, determined to make a difference.
We see a lot of patients every day, and we're understaffed, and we just can't keep up with how many people are coming to the hospital.
Last year, Governor DeSantis signed a bill approving more than $100 million in recurring funding for mental health. Those in the industry say it is a good start, but it will take more to make a real difference. Getting results, I'm Lewis Bolden, News 6.